were confirmed by the Senate on February 13th, so I'm sort of assuming that things happened before you were confirmed were other people's work. On January 28th, the Fork in the Road letter came out to people across the federal employment space, widely attributed to OPM and Elon Musk and Doge. But that was before you were confirmed, so you had nothing to do with the Fork in the Road letter, correct?
Correct.
Okay. You were confirmed on February 13. On February 14, one day later, HHS announced that 3,500 probationary employees were going to be laid off. I know you're a hard worker, but am I right to assume that in the one day between your confirmation and the next day, you weren't the primary decision maker about laying off probationary employees at HHS?
I was aware of it, and I could have blocked it.
Yeah, you were aware of it, so you weren't the primary decision maker. Was that a decision that was made like OPM or Doge? And because it wasn't just HHS, it was all federal agencies who would lay off probationary. Do you know where that
I had my full upper staff in place before I got there.
Right, but did they make the decision, or was it White House and Doge to lay off probationary employees?
They made the decision. My staff made the decision,
Okay.
although Doge came in and Doge gave us information that we wouldn't otherwise have had access.
Okay. Next, we go to April 1st.
I can also say this.
No, all I asked was if you made it, and you answered the question, and I appreciate it. April 1, HHS RIFs 10,000 employees effective June 2. Now, by this point, you had been secretary for about 6 weeks. A few days after that announcement, HHS staff briefed our staff, the Senate help staff, and basically, just here's some highlights. In that 10,000 RIFs, 467 staff at the Administration for Children and Families, 2,473 at the Centers for Disease Control, 322 at CMS, 400 at HRSA, 1,312 at National Institutes of Health, 197 at SAMHSA, 2,519 at the Food and Drug Administration. By now, you've been secretary for 6 weeks, so this was RIFs, not the forks, but you were involved in the decision about these 10,000 RIFs, correct?
Yes.
And in tandem with your leadership team, correct?
Yes. Yes. And as I said before, I pushed back on certain ones and canceled certain ones.
Yeah. I think yesterday, it may have been earlier today, you confirmed that 20,000 employees have been let go, 10,000 at HHS, 10,000 RIFed and 10,000 forked. Do you know how many of the 20,000 were veterans?
No, I do not.
That is a fact that's very easy to determine from someone's personnel file. So I'm going to ask that question for the record. We are finding across the government that veterans are disproportionately being let go, A, because they're a higher percentage of the federal workforce, and B, they're a dramatically higher percentage of probationary employees because they leave military service after 10 or 25 years, and then they're probationary new employees when they join the civilian service. So I want to find the answer to that question. Where does the rubber meet the road on 20,000 RIFs and layoffs and forks? In people not getting cancer trials, and I appreciate your willingness to help Senator Murray's constituent, in state grants being canceled, in Virginia losing $425 million in funding to the Virginia Department of Health. But here's a small example. All of our offices do casework. All of them do casework. And we get requests from constituents all the time. CMS is the largest agency in the federal government. Its budget is nearly twice the size of the Pentagon. And people who depend on Medicaid, Medicare, and the S-CHIP program really, really depend on it. And it's the most consistent in the top 3 or 4 in terms of constituent requests to my office. Answer this question about Medicare or Medicaid or the S-CHIP program. In every administration I've served with, Obama, Trump 1, Biden, I get answers to questions on behalf of constituents. I may not get them as fast as I like, and sometimes I like the answer and sometimes I don't. But let me show you what CMS is now doing to answer constituent questions. I've omitted the name of the constituent, and I've omitted the name of my staffer. This was very recent. A hardworking retiree, patriotic tax-paying American who's on Medicare wrote to ask CMS a very simple question about Medicare. Couldn't get an answer. Asked us to reach out. We reached out to the Medicare Part C and D Congressional Liaison Office. And here was their answer to our basic question. Unfortunately, there is not an update to provide with the recent change of administration, we are unable to provide any information on matters related to Mr. X's request, Congressional Casework Team. I mean, if you're just an everyday, hardworking American retiree on Medicare, and you have a basic question about it, you ought to be able to get an answer. And I'm just going to say, I've shared this with my colleagues, and many of us are having the same experience where our constituents can't get a basic question answered. I wonder if 20,000 fewer employees is connected to this. I yield back, Mr. Chair.
I've been sitting through this hearing all day today and have noted that you've been unable in most instances to answer any specific questions relating to your agency.
Because I haven't been given time.
Well, no, you have been given time, but the point of the matter is you've been unable to answer specific questions. Sir, you are the wrong person for this job, and you had in this hearing today the unmitigated gall to say at the beginning of your testimony that China is ahead of the United States in healthcare because China does not have DEI.
I didn't say that.
Well, we can roll back the tape. You absolutely did
And you will
say
find I didn't say that.
that is absolutely what you said.
I was talking about science. I didn't say they're ahead of us. They're ahead of us in some forms of science, certainly not in healthcare.
Well, we can roll back the tape, but nonetheless, let me go on with my questions and ask you this. You just heard about the Safe to Sleep campaign, and you have made cuts. You made it very clear here today. You have no knowledge whatsoever of the absolutely amazing scientists and researchers who you have callously fired. You know nothing about the cuts.
You can fire any working scientist, Senator.
That, sir, is not true either. But nonetheless,
it is true.
It is not true. Let me ask you another specific question. The Safe to Sleep campaign. Well, then can you name, sir, which office the Safe to Sleep campaign operates out of?
The which campaign?
Well, that's the one that the senator just asked you about 2 minutes ago that prevents babies from dying in their sleep. A 30-year program inside your agency. You would agree that it's important.
I think it's part of HRSA or ACF. It's ACF.
No, actually, it's in Health and Human Services.
Yeah.
And I think, and again,
now, they're all within Health and Human Services, but the subdivision is ACF.
No, actually, the name of the
Administration of Children and Families.
No, let me tell you what it is. The National Institute of Child Health and Human Development. This is actually the one that your aunt, Eunice Kennedy Shriver, is the person who it's named after. And you noted just a moment ago, the senator reminded you that although this is a very important agency, prevents babies from dying, this is the same one you fired every single person in this office as of April the 1st. It is also,
as I said, there were no working scientists fired during the RIF.
We can bring you that information later, but because what you just said is not true. Well, then the question also is, in addition to firing the individuals who make sure babies don't die in their sleep, why did you cut funding and staff from the CDC's National Center on Birth Defects and Developmental Disabilities, which supports the Special Olympics? Was that a mistake? I've heard you say you've made some mistakes today. Was that also a mistake?
We switched those programs to the Administration for Healthy America. They have not been cut.
Well, the funding has been cut, and this is one that oversaw the Special Olympics. Are you aware of that?
We have not cut the Special Olympics.
You've cut the funding, and you also dismantled the Division of Reproductive Health and Women's Health and Fertility. You're aware of that, right?
Right now, we have 42 divisions that do maternal health, and we're consolidating them. And the mainstream media has portrayed those as cuts, but they're not cuts, they're consolidations. It's ridiculous to have 42 divisions that are all supposed to be doing the same thing with their own administrators.
Well, let me ask you a question. So it doesn't exist right now. It's been dismantled. That is a fact. That particular division, what you plan to do in the
There's 42 divisions on maternal health we consolidated.
Sir, let me finish what I'm saying here. The fact of the matter is you have dismantled it as we speak. And are you aware, what does the assisted reproductive technology mean to you? Are you familiar with that?
Are you talking about IVF?
Well, it's assisted reproductive technology. It's a division. Do you know what it does?
Is it part of NIH?
No, it's actually a part of your agency. It's a
Oh,
part.
NIH is part of my agency, Senator. You should know that.
I do know that, but it's actually a part of, it's the CDC is where it is.
Okay, then it's CDC.
Right, okay. Let me just ask you, and again, these are all of the things you seem unfamiliar with, the ones, the programs that you've cut.
You're unfamiliar with my agency, that NIH and CDC are part of HHS.
Oh, I absolutely know. NIH is in my county. I was there this past weekend with the researchers that you have fired. So I absolutely know where NIH is, sir, and don't need any help from you in knowing that. I see the time. Thank you.
Senator